Clindamycin, also known as Cleocin Hcl, is an antibiotic used to treat a wide range of bacterial infections. It works by stopping the growth of bacteria. It's important to note that this medication only treats bacterial infections and will not work for viral infections like the common cold or flu. Using antibiotics when they're not needed can cause them to be less effective for future infections. Be sure to follow your doctor's instructions carefully. The dosage and timing of taking Cleocin Hcl will vary depending on the type and severity of the infection, so it's important to consult with your healthcare provider for the best approach. When taking Cleocin Hcl, it's important to follow your doctor's instructions. You can take this medication with or without food, and it's usually recommended to take it 4 times a day, about every 6 hours. Make sure to drink a full glass of water with each dose, unless your doctor tells you otherwise. After taking the medication, try not to lie down for at least 10 minutes. The dosage will depend on your medical condition and how you respond to the treatment. For children, the dose will also be based on their weight. To get the best results, try to take this antibiotic at the same times every day. This will help you remember to take it consistently. Keep taking Cleocin Hcl until you've finished the full amount prescribed, even if your symptoms start to improve. If you stop the medication too early, the infection could come back. If your condition persists or worsens, be sure to inform your doctor. If you experience nausea, vomiting, or diarrhea, let your doctor know. This medication has been prescribed to you because the benefit outweighs the risk of side effects for most people. However, some serious side effects may occur, such as heartburn, joint pain/swelling, yellowing eyes/skin, dark urine, or signs of kidney problems. Prolonged use may lead to oral thrush or a new vaginal yeast infection. Contact your doctor if you notice any new symptoms. While a serious allergic reaction is rare, seek medical help if you experience symptoms such as fever, new or worsening lymph node swelling, rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice anything unusual. And remember, if you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. If you are prescribed Cleocin Hcl, it's important to be aware that it may rarely cause a severe intestinal condition due to a bacteria called C. difficile. This condition can occur during treatment or even weeks to months after treatment has stopped. If you develop diarrhea that doesn't stop, abdominal or stomach pain/cramping, or notice blood or mucus in your stool, it's crucial to inform your doctor immediately. It's also important to note that if you have these symptoms, you should avoid using antidiarrhea or opioid products as they may make the symptoms worse. Always follow your doctor's instructions and never hesitate to seek medical advice if you have any concerns. Before taking Cleocin Hcl, make sure to inform your doctor or pharmacist about any allergies you may have, as this medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have liver or kidney disease, stomach or intestinal diseases, or any allergic conditions such as asthma or eczema. Additionally, it's important to note that Cleocin Hcl may affect the effectiveness of live bacterial vaccines, so be sure to inform your healthcare professional if you are using this medication before receiving any immunizations or vaccinations. Before undergoing surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For older adults, it's important to note that they may be more sensitive to the effects of Cleocin Hcl, especially when it comes to experiencing diarrhea. If you are pregnant or breastfeeding, be sure to consult your doctor before using this medication. When taking Cleocin Hcl, it's important to be aware of potential drug interactions. Certain medications or herbal products may affect how Cleocin Hcl works, or increase the risk of serious side effects. To ensure your safety, keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Cleocin Hcl is kalinpectin. Be sure to discuss any potential interactions with your healthcare provider. If someone has taken too much Cleocin Hcl and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can reach out to their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center for assistance. It's important not to share Cleocin Hcl with others. This medication is prescribed specifically for your current condition, so do not use it for another infection unless your doctor advises you to do so. If you are using this medication for a longer period of time, your doctor may recommend lab and/or medical tests to monitor your kidney and liver function, as well as your blood counts. Be sure to consult your doctor for more details on this. If you happen to forget a dose of Cleocin Hcl, take it as soon as you remember. However, if it's almost time for your next scheduled dose, just skip the missed one and continue with your regular dosing schedule. Do not take a double dose to make up for the missed one. It is important to take this medication consistently and at the same time each day to ensure its effectiveness. Make sure to store Cleocin Hcl at room temperature, away from light and moisture. It's important to keep it out of the bathroom and out of reach of children and pets. When you no longer need it or it's expired, make sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for the best way to do this. And remember, don't flush it down the toilet or pour it into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.